I was having problems when watching TV. The picture was starting to look blurry and I could see circles of light around bright lights. I visited my opticians and after doing some tests, they told me I had cataracts in my eyes. This is when the lens inside your eye becomes cloudy, usually due to getting older. They said if your cataracts aren't too bad, a change in your glasses prescription and brighter reading lights may help for a while. But the only treatment proven to work and be permanent for cataracts is surgery. I wanted to get it sorted, so they talked to me about the surgery. It involves removing the cloudy lens and replacing it with a clear artificial lens called an intraocular lens. This will remain in place for the rest of my life. Once I agreed to go ahead, they referred me to my chosen hospital for more tests and to see if surgery would be suitable for me. I got an appointment to visit an eye clinic to have further tests. First, an eye care professional took measurements of my eyes and checked my eyesight to see which intraocular lens I needed. I then saw the eye doctor who asked me how the cataracts are affecting my life and explained the benefits and risks of the surgery. They told me what type of lens I will get during the surgery. We completed some questions to make sure I could have the surgery safely, and I signed a consent form. I was given eye drops during this appointment that made my pupils bigger. They blurred my vision for around 4 hours, which meant I had to ask my neighbour to drop me off and collect me afterwards. I was just having a local anaesthetic for my surgery, so I was told I could have drinks as normal and that I was able to eat up until 4 hours before the surgery. If you're having a general anaesthetic for your surgery, you'll need to stop eating and drinking for a period before your surgery, and further checks may be required, but that will all be explained to you. I was told I had to continue to take my medications as normal and to bring a list of my current medications with me. I made sure I wore comfortable clothing and I didn't wear any makeup. When I arrived, a member of staff greeted me and checked my details. I agreed it was my signature on the consent form. Then a member of the nursing team prepared me for the surgery. They gave me the medication to dilate my pupils as a small pellet placed in the lower lid of my eye. In the operating theatre, I was asked to lie down on a bed and the nurse put in local anaesthetic eye drops. Most cataract surgeries are done under local anaesthetic, which means I was awake for the surgery. Once my eye was numb, the surgeon cleaned the skin around my eye and placed a sterile cover over my eye. They inserted a small clip to stop me blinking during the procedure. They removed the cloudy cataract and inserted a plastic lens in its place. I only saw some vague movements around my eye, but I didn't feel any pain or see what was happening. My eye was covered with a plastic shield to prevent me accidentally rubbing it while the anaesthetic wears off. It was all done in less than 30 minutes. After the surgery, a member of staff took me back to the ward where a nurse checked my blood pressure and pulse. I could go home the same day, but I needed someone to drive me home and look after me for 24 hours after the surgery. I was given some eye drops to help with the healing process, which I had to use regularly. I was told I had to avoid doing any strenuous activity for 2 weeks. My vision was blurred and sensitive to light for the first couple of days after the surgery, and it took a few weeks before I saw the final results. I had a follow-up appointment at my optician where they checked my vision and made sure that my eye had healed properly. The whole experience was not as stressful as I thought it would be, and I'm over the moon with the result. I still need glasses for reading, but I can now see the TV much clearer.